to know if y'all had been on classes with me before is because we are changing things up a little bit and want to get your feedback, especially for the people who've been around for a while. We would love to hear if this improves your experience in terms of having more interactive components. So I like to think about this as your path to a healthier heart. My name is Abby Horton. I teach at the Capstone College of Nursing here at UA. I'm an assistant professor. I'm a registered nurse, a certified health and life coach, a former Wellbeing Ambassador for the Honors College, and one of your wellness class educators. So you can reach me at abby.horton at ua.edu. And so if you have any questions, comments, feedback, anything that you want to connect around, please feel free to reach out. I'm always happy to answer your questions or connect you to resources. So my disclaimer is that this presentation is just for educational purposes only and doesn't constitute medical advice. This class is more medical in nature, and I'm happy to answer questions in a general sense. But if you have specific questions about specific numbers or things like that, health concerns, you definitely want to contact your healthcare provider because they're going to know all of your health and wellness background, your health history, your family history, and they can be the ones best prepared to give you tailored feedback for what you have a question or concern about. So, our objectives today are to talk about cholesterol from the point of, what are some of the common myths or some of the common things that maybe we misperceive about cholesterol and what its role in heart health is. So, we're going to understand the relationship between cholesterol and hypertension, the risk factors for both, which obviously impact your cardiovascular health or your heart health. And then we'll talk about some healthy habits that you can start to incorporate to really address your heart health. So, not only your heart, but your blood vessels, your high cholesterol, your high blood pressure. And we'll even talk about high blood sugar because that can also play a role in terms of inflammation in the body. So, we're going to start with a knowledge check. So, which of these lifestyle choices do you think would have the most significant impact on improving your cholesterol levels and why? So, you can pop in the chat a 1, a 2, or a 3. All right. Seeing lots of ones, a 2, a few twos. Yeah. All of them. Yeah, all of them would impact your cardiovascular and cholesterol health for sure. But the one that's the most significant impact. Yeah. I'm gonna give y'all just another second to respond. Awesome. Yes, absolutely. All three of these, reducing your processed foods and eating more whole plant-based foods, increasing your daily physical activity and managing your stress, getting enough sleep, all of that would impact your health. But the one that's going to impact your health the most is going to be number one, your diet. So it has the most direct and measurable impact on cholesterol. So foods like whole wheat, whole fiber, high fiber vegetables, fruits, whole grains, nuts, legumes, all of that is going to directly affect your cholesterol. All right, so knowledge check two. High cholesterol always causes noticeable symptoms. True or false? Yeah, lots of falses. Absolutely not false. I love the enthusiasm. Absolutely. False. So we often talk about in healthcare and with my nursing background, we talk about um, you know, pressure or hypertension being the silent killer. And really, I think that the silent killer, if we're going to label something that, would really be high cholesterol. Because when you have high blood pressure, you do actually have some symptoms once you start getting those high level, stroke level high blood pressures. So things like fatigue, headache, pounding sensation in your head, a very full sensation in your head, eye strain, and eye issues. And so, for hypertension, you do have those noticeable signs and symptoms at a point. Early on, when your blood pressure is high, you might not feel it. But with high cholesterol, you usually don't have any symptoms. And so I think that that's really a misnomer when we're labeling things as silent killers. And so definitely want to keep a check on your cholesterol because you may not even know. A lot of times what happens is you go to the clinic, the hospital, the regular annual physical exam, and they'll say, "Oh, you have high blood pressure. I wonder what your cholesterol is." And they'll be like, "Oh, it just so happens that your cholesterol is also high." Well, that shouldn't come as a surprise because a lot of times high blood pressure is because you have high cholesterol, and we'll talk about why that is. Now, you absolutely can have high blood pressure without having high cholesterol, but a lot of times the high cholesterol is the reason why you have high blood pressure. And there are some examples of reasons why that is not always the case. Things that are like hormonal in nature, like pregnancy, for one, can increase our hypertension rates or our high blood pressure readings. And we'll talk about the difference between calling something hypertension versus high blood pressure. But for the most part, if you have chronically high blood pressure, it's going to be because you have a cholesterol issue. So, cardiovascular disease is the world's #1 killer. Again, we're talking a lot about some, really difficult topics right now. And so, death and dying and those kind of things. But it's so important to know our numbers. What we can measure, we can manage. If we can't measure it, if we don't know our numbers, then it's really, really difficult to manage the kinds of things that are going to impact our overall health. So these are some numbers for you. Again, it's the #1 issue in terms of our health and our wellness. It's the #1 reason why we have hospitalizations and why we have causes of death. We hear a lot about respiratory diseases, especially since COVID. We hear a lot about cancer, but really it's cardiovascular health that's becoming the #1 reason why we have chronic health conditions and concerns. Can you have a normal blood pressure but have high cholesterol at the same time? Yes. And the reason for that, Abby, is because your body will compensate. And sometimes our body compensates by raising our blood pressure, and sometimes our body compensates by raising our cholesterol, and sometimes our body does both. So it just depends on the person. It's very bio individual. You'll hear me say that a lot when I teach classes. So definitely you can. And the thing is that cholesterol is going to be more of a stable number, meaning that it's going to probably track pretty stable across the week, across the month. Blood pressure is going to have rises and falls and dips and things throughout the day. So if you're sitting at your desk right now pretty calm and you've not gotten anything, that has come across your desk to really upset you, you've been sitting, at your desk for a couple of hours, you're not moving that much, you feel pretty relaxed, your blood pressure is probably pretty stable at your normal baseline. But if you were to go out and try to get lunch, later today, or when you're leaving in, 5 o'clock traffic and traffic is bothering you because maybe you're late or maybe you're just tired and want to get home, your blood pressure will raise. And so that's when we'll talk about the difference between hypertension and high blood pressure. But you also have factors like the things that you eat influence your cholesterol. And so definitely it's a very nuanced relationship between the two. And that's why it's so important to get your numbers tracking as much as you can so you kind of know what's your pattern. Teresa says blood pressure is always up, even on blood pressure medications, but also on a cholesterol med. It's always borderline. Yeah, we'll talk about that, Teresa. That's very true for a lot of people. You're not alone. So, cardiovascular health, when we look at just heart health in general, it refers to the health of the heart and the blood vessels. And so, you can't really talk about cardiovascular health without talking about brain health because when you're having an issue with your heart, the reason that you want to pay attention also to the brain is because your brain just hasn't, it's upstream, right? And so when you have an issue with blood vessels or inflammation or blood pressure or, blood sugar being elevated, cholesterol being high, your brain is going to be impacted just like your heart is. It's just a matter of whether the issue is going to the heart first or the brain's going to be impacted first. Okay. So anytime you think about heart health, think about brain. Anytime you think about brain health, think about heart because they talk to each other. And so there are several risk factors for developing cardiovascular disease: high blood pressure, high cholesterol, tobacco use, diabetes, high blood sugar, inflammation, especially if you have chronic inflammation, which we'll chat about, but also genetics. You know, we talk a lot about lifestyle because lifestyle is what we can really influence, and our lifestyle influences our genes. It's called epigenetics. And so I think it's so important to talk about lifestyle and the things that you can do and manage on your own or with help from a provider, but it's equally as important to talk about genetics because our lifestyle influences whether those genes, quote unquote, turn on or activate. But you also want to give yourself some grace. So I have a couple of genes that I've learned about over the last couple of years, where I have genetic. People used to say mutations, now they say variants or variations. So I have two genetic variants that put me at an increased risk for cardiovascular health. And that makes total sense because everyone in my family, on both my mom and my dad's side of the family, the majority of the reason why they have died early in their life is because of a cardiovascular or brain health issue, either from stroke or heart attack. And so it makes sense that everyone in my family, you know, for the most part, has been impacted by this because we all are having these same genes, right? At different levels, obviously, we're all different people, but we all have this, you know, genetic variant. And so when we think about genes, it's not that we don't have any control, it's that we have to just take into control what we can, right? So I can't change my genes. That's called genetic origami, where you snip genes and you piece them together. I can't do that, right? But I'm not going to live in fear of the fact that I have these genes. So, even though I'm walking out a health journey with both of my parents, both of them have had early onset heart attacks and cardiovascular issues. I'm not going to live in fear of that, but rather I'm going to be empowered to how can I take care of my body and my genes in the best way possible so that what I can control, right? And a lot of times it's just our attitude and our effort. And where we direct that effort are the things I'm going to talk to you about today. So it's walking more, it's managing our stress, which is so easy to say and harder to do. It's looking at the foods that we're eating, it's really understanding how our body works and how it compensates so that when you go and make choices about what you're going to do with your day, with your meals, with your walking, all of that, you can make the best choice possible. And when you need a treat, right? Like we probably all do at some point this week, you can make a really intentional choice about what that treat is. So you're not defaulting to a drive-through on the way home because you're kind of like mindlessly riding home, but you're intentionally saying, you know, at the end of the week on Friday, I'm going to go to this place and do this thing, and that is going to be my treat for the week. And that might be a non-food treat, or it might be something, you know, that you do go and get from a drive-through, but you're doing it with intention and you're not doing it every day. So I want you to leave this class with a lot more knowledge and feeling really empowered and maybe encouraged to make some good, healthy changes. So typically we teach this class in February and we talk about Go Red for Women Month, which is in February. I left this one slide in because I just wanted to call your attention to it. I think it's so important because Go Red, a lot of people don't know, is an acronym for Get Your Numbers, Own Your Lifestyle, Realize Your Risk Factors, Educate Others. So, especially your loved ones who may share similar genetics or similar lifestyle habits, you know, tell your family and friends and your coworkers, and then don't be silent. And that means that if you feel like there's a problem, go ahead and reach out to your healthcare provider early so that you can get the help that you need. Early intervention on all of these lifestyle or chronic disease, um, you know, kind of manifestations that we talk about, it's so important to catch the things early because you really can make a difference. And in some cases, reverse early hypertension, early diabetes, or prediabetes. It's not out of the realm of possibility. And so I really want to encourage you with that. So, cholesterol and hypertension, these are two graphics here that really explain their relationship. And there's a lot here that you could look through to be able to kind of understand it better. So, I'm going to let you dive deeper into that on your own. But most people don't know that they have high cholesterol. Most people don't know that they have high blood pressure. So, that's why it's so important to go to our well-being screenings, to go to your annual physical exam with your healthcare provider because keeping a check on your numbers is so important. I'll give a little anecdotal story here and there because I think it humanizes this, right? I teach you from experience. I don't teach you from a textbook. And I have a lot of life experience, unfortunately, with hypertension for this case. But several years ago, when I was in graduate school working on my doctorate, I was in clinical at a community health event with students. And I noticed that I was not feeling well. We were at an elementary school doing health screenings of all things in a couple of counties away. And I noticed that I was feeling extra stressed. And I was like, well, it's just a stressful day. We had an early drive, it was an hour and a half to and from. I had really little kids at the time. And I was in graduate school working full time. So I was like, it's just another stressful day in the life of Abby. And so I finally started feeling worse, and I thought, okay, I'm gonna probably need to just check my blood pressure or blood sugar. I mean, what else can I check here until I can get home and call my doctor? And so I had one of my students that was really, really great, really sweet student, and I said, hey, could you come over and just check my blood pressure for me? I just want to make sure that it's not high because I'm just feeling a little foggy headed. I had a bad headache, started having ocular or eye pain. And so she took it and she said, oh, and at the time, of course, I was still Mrs. Horton. She's like, Mrs. Horton, she's like, I think I may be wrong. I think I need to go get one of the teachers to check it because it's really high. So I must have this wrong. And I was like, no, you're probably right. And I had spent all of my life because I do have a heart condition with really low blood pressure. And so another faculty came over and checked it, and I had stroke level high blood pressures. So fast forward, I get a prescription at the doctor's office that day. They told me to leave immediately, and I said, no, I'm going to finish my clinical day. Finished my clinical day, drove to Tuscaloosa, walked away with a prescription for hydrochlorothiazide, which is a really common prescription to first line defense high blood pressure. Typically, you have to have 3 high blood pressure readings to get a diagnosis of hypertension. Because mine were in the stroke level ranges and I was symptomatic, meaning that I had like all of these symptoms I could tell them about, they went ahead and gave me high blood pressure medication that day in the diagnosis. So fast forward another 3 to 4 years, almost 4 years later, I was able, because of diet and lifestyle changes and being monitored with a cardiologist, for my underlying heart condition that was contributing to all of this, I was able to get off hydrochlorothiazide. Y'all, that's almost unheard of. And that's why I share that story because you're not going to go and Google search or talk to a friend or neighbor or someone at your church or someone in your office and hear about how they got on a medication and then were able to wean off of that medication with their doctor's permission and approval, and kind of change their life. That's not something that's really common. And so I offer that as a source of inspiration and encouragement, that there's always something you can do that even if you're not able to get off the medicine totally, you might just reduce the medication with your provider's help because the lowest level of medication that you can be on to maintain good health and good numbers is what you want to strive for. And so in these images, it shows the yellowing. That yellow is meant to represent cholesterol. And in this image right here with a little red bubble, that's supposed to be blood. And so as your cholesterol increases, if you can't use it up, it's going to get deposited in these vessels. And the more that it gets deposited, it's like a garden hose, like a water hose in your yard. If you left that out with water in it this winter, it's probably going to have some buildup and some rust and some corrosion in it when you go turn it on this spring because, all of that deposit or what we're saying cholesterol here gets in and it just narrows that vessel. And so the more that that vessel narrows because you've got this cholesterol building up, the harder that blood has to go through the vessel to get where it needs to be, your heart, your brain, your other organs, right? So that's your blood pressure is increasing to get through the narrow opening that the cholesterol has caused. And there are many other reasons why blood pressure can raise. But that is one of the common ones that has sustained high blood pressure. Okay. So that's the relationship. Now, cholesterol is talked about as being a bad thing. Cholesterol is not bad. Cholesterol is necessary. So, cholesterol is made by the liver. Cholesterol is also something that we eat. And so we eat foods that have cholesterol in them. Put in the chat if you can think of a cholesterol food, something that's really high in cholesterol by our standards, what's the first food that comes to mind? I can tell about what y'all are thinking about. I think some of y'all are hungry. Ribs always make me hungry. Yeah, y'all are so good. Shrimp and eggs. I always think about eggs first, and eggs is always the example that's given. But the thing is that it's okay to eat foods that have cholesterol in them. They're usually healthier foods like eggs and shrimp. And if you don't have an allergy or some reason that you can't eat that, they're not inherently quote unquote bad foods, right? We like to moralize things and say, oh, this is good or oh, this is bad. Well, really, it's just, is it a healthy food for you? And I can't answer that for you. But you have to know that there are certain foods that have more cholesterol than others. And so those are going to be things like animal products, different types of oil like palm and coconut oil, baked goods and sweets and things that have preservatives in them, trans fats. You always want to look for zeros, trans fats, because those are going to be things that have what I would say are called human made chemicals or man made chemicals for preservatives. And so those are going to be things like margarine or store bought cookies, crackers, cakes. Anything that's going to be in those middle aisles can be at risk for having high cholesterol. Um, and then, fried foods, of course. And we love our fried foods. My hand is raised. I love fried foods. And so you want to really think about having your saturated fat, your trans fat, your sodium, added sugars be something that you just include as accessories, things that are not staples in your diet. And then choose lean meat, seafood, fat free or low fat milk. No, I make an exception for me and my family. I've made the choice that if I'm going to have them drink milk, it's going to be full fat milk, and that's a personal choice. Um, but we reduce it in moderation for that reason, and we make up for it in other ways in terms of getting their calcium, and things like that. Cheeses and yogurt, I prefer full fat for a couple of different reasons related to inflammation. That's just personal for me and my family. But the recommendation is going to be fat free or low fat. And with the fat free and low fat, you're probably going to have more chemicals and sugars and additives to be able to make that be preserved and flavorful. And so that's why I choose the more full fat options in lower quantities. And then eat whole grains, fruits, and vegetables, foods that naturally have high fiber, like beans and oatmeal. And then foods that are unsaturated in fat, such as avocados. So, avocados are actually really good for you to get a good fat source. And then vegetable oils like olive oil, and then nuts and seeds, which most people don't get enough of those. So, those are the kinds of things that you can include. So, cholesterol, when we think about it, we think about healthy cholesterol. So, HDL. We taught our nursing students, if it's an HDL, it's the healthy one, and if it's the LDL, it's the quote unquote lousy one. Just so nursing students could remember that, right? Same thing happens in medical school, but then that translates to our patients and the general public thinking that LDL is bad and HDL is good, when really both are needed. And then you've got, of course, got our friend the red blood cell here. So cholesterol is mainly a fat and a lipoprotein. And the lipoprotein part is cholesterol plus protein plus your fat or your triglycerides. And so every cell in the body requires that we have cholesterol. And so that's sometimes why you have a lot of symptoms when you go on a statin or a cholesterol lowering medication, because every cell in your body at the cellular level needs cholesterol to function. Cholesterol is responsible for hormone synthesis, meaning it helps make the hormones in your body. It also helps with vitamin D production and synthesis, and just for all other normal body functions. And so that is why a lot of times people feel really not great on statins. Some people do really well. Some people feel like they have the flu. So for my husband, my mom, other family members, they've taken statins and really haven't seen, a lot of improvement, but saw a lot of symptoms and side effects. So when my cholesterol started creeping up with this high blood pressure issue several years ago, I actually took the hydrochlorothiazide but refused the statin. That was just my personal choice because I knew I was going to really work on reducing my inflammation and lowering these numbers through lifestyle. And I was able to do that with my provider, my medical doctor's permission. And it worked out for me. That was a good choice for me. So those are the kinds of things I want you to know so that you can have that conversation with your healthcare provider and make the best choice for you. So cholesterol is a soft, fat-like, waxy substance. So think about kind of the fat that you get off of a meat that you cook, kind of that gelatin-like fat that you'll get off meat when you cook chicken or beef or something like that. It's very much that kind of waxy substance. So y'all know if that's in the bloodstream, it's going to make the vessel and the blood and all of that thicker, and it's going to make it kind of that waxy substance too. And that's why it's so difficult that when you start to get those layers of cholesterol deposits in your vessels and arteries, it's so difficult to clean that out. And then add on top of it that you have high blood sugar. Maybe you're consuming a lot of blood sugar, or maybe you have diabetes, and then that makes it even stickier. And so that's why drinking water and exercising and having plant-based foods that have more fiber are so important, because that fiber, that movement, that water is going to help dilute all of that cholesterol, all of that extra sugar, and help clean out the vessel. It's like your cleaning system for those vessels. So cholesterol is normal and it's a healthy aspect of your body. Your liver makes it. Your liver makes most of the cholesterol. Your liver makes more cholesterol than what you eat. And the reason I want y'all to know that is because, yes, you absolutely need to address over, you know, the course of making a lifestyle plan, you need to make sure that you're lowering the cholesterol that you're consuming, especially if it's from those sources like fried chicken and not eggs, right? But the thing is you've got to address more than just what you're eating, because your liver is making more of it. That means you probably have an inflammation issue. And that is what you probably want to focus on once you've made all of the other easier, simpler changes. There's something going on in the body that's causing you inflammation. And that might be stress, or it might be that you're eating too much fried chicken, or it might be that you're doing both, or that there's an underlying issue, right? So your body needs that cholesterol. And what you look at when you have HDLs and LDLs, which we just talked about, you also have triglycerides. So any extra fat that you're eating, especially fat that's not coming from things like avocados, that gets stored in the body, it gets stored as a triglyceride or in a fat cell. Okay, so then we're even adding kind of more burden to the body, because when we have extra fat on board, or adipose tissue is what we call it, then that's also causing issues because it's compressing those vessels. So now those vessels are compressed because of the external fat or adipose tissue around them, and it's sticky from blood sugar, and it's sticky from cholesterol, and you're trying to get this thicker blood through those vessels because we're not drinking enough water. Hand is raised. And so it's making it kind of difficult for your body to compensate. I hope this is kind of painting the picture. Y'all let me know in the chat, is this helpful? Um, okay, cholesterol. Yeah, everything that you make in the body in terms of hormones and vitamin D, those kinds of things, those are going to be the things that require cholesterol the most. Yes, Mediterranean diet is always a good option, I think, for most people. Um, okay, good. I'm glad this is helping. So in the liver, you've got the picture of the liver here, and you've got LDL. So LDL is being made by the liver. So it's the lousy one, quote unquote, and L and L. So, LDL is lousy, made by the liver. Okay. We know it's not really lousy, but it helps us remember. So it is made in the liver. If you have inflammation or other things going on with the liver, which is like our big filter for the body, right? This is like our pool filter. It's getting all of the debris in the body. So it's making more LDL because it's like, oh, we need more helpers out there. We need more people out in the blood cleaning this up because we've got too much debris. Okay. And so we've got too much debris, so it carries the cholesterol to the cells, because the cholesterol is the thing that goes and helps patch the problems, right? So cholesterol comes in and is like, oh, you've got a little plaque, a buildup, or you've got a little inflammatory tear in something. I'm going to take cholesterol there. I'm going to deposit it or put it on the side of that vessel and fix it. So cholesterol is like the little band-aid for all of the problems in the vessel. Well, then when you get done with that, if there's extra LDL left over that wasn't used by the body, then the HDL comes in like the little Pac-Man, and the little HDL is the helper that's trying to clean up the extra LDL in the blood, right? Because at the end of the day, it's still cholesterol. And so the HDL goes in like Pac-Man, gobbling up the LDL. Well, here's what happens. Usually there's more LDL than HDL. And if you don't have enough HDL, then there's not enough Pac-Man to actually eat the LDL. Go with me on the eating. It doesn't really eat it. It just kind of absorbs it. And so the HDL then is supposed to absorb it, be taken back to the liver so that the liver can absorb it and it can get recycled and the whole process starts over again. Okay. Well, when we don't have enough HDL to do that, then what ends up happening is that gets deposited, that extra LDL gets deposited in the vessels, and that's where you get these plaques, which are what can kind of pop. Now, this is going to be a little gross, but when those plaques are attached to the artery, what happens is that they can sometimes pop like a pimple, and then that's when you can break a vessel, and that's when you can have like a hemorrhage, or you can have a stroke, or you can have a heart attack, because that vessel then becomes compromised because that plaque popped like a pimple, and it can actually pop the vessel. Is that helping? I know that imagery is not the best, but it is very accurate. So triglycerides then are things that come from like trans fats. So it's extra fat, it's trans fats, which are really not fats. They just said that. It's a chemical that preserves our food because we're not eating kind of farm to table local anymore. Okay, so when we look at butters, oils, fats, and things, people are going to tell you to go to like reduced margarine, or I can't believe it's not butter, or things like that. Again, not mainstream on this. There are a lot of people who would support me in this. People like Dr. Mark Hyman, people like Dr. Casey Means, that would tell you that butter is probably better. The real thing in moderation is probably better than the reduced fat, added chemicals option. But you do what you feel is right for you and your family. Talk to your healthcare provider, schedule a registered dietitian, nutritionist consult. But for me, again, I like to do the real thing in moderation. So when you look at your consumption and you look at your calories, you need to make sure that the fats that you're getting are from healthy fats, that the things that you're doing to reduce your fat intake are helpful for you, because our brains need fat. We don't want to go completely low fat, completely low calorie, because we're draining our body then of the fat that's needed for our brain, and we're really depriving our body of the energy that it needs to take care of the problems that we've kind of created for it, right? So if you're depriving it of water, you're not giving it enough rest, you've got stress on board, then you cut your calories, then you cut your fat, and you still have that adipose tissue on board, so it's still compressing those vessels. You still got the cholesterol. You still got the high blood pressure. And then, like, if you're like me, we're like, why am I so tired at the end of the day? It's because we're not giving our body what it needs to heal itself. And our bodies are designed to heal themselves if they have what they need. Okay. So that's our focus. Give our bodies what it needs. So this is a level of triglycerides. So these are just some numbers through the American Heart Association. In terms of what is normal, we like to see it less than 150 for triglyceride. And y'all will have these slides, so you don't have to memorize this. You can go back. And then the types of fat, I always like to use a red light, green light system for myself, but also for my kids, my patients, my coaching clients. So trans fats would be red. It's those preservatives, artificial chemicals, things like that. That's going to trigger the liver to make more cholesterol because it's causing inflammation in the body. Anything that the body recognizes as foreign usually causes inflammation. And then saturated fats are going to be the yellow. So animal fats, full fat dairy, again, it's going to trigger the liver to make more cholesterol. And then the unsaturated fats are going to be the green, the healthy fats. So things like salmon, avocados, almonds, walnuts, olive oil, flaxseed. Lots of good lists out there. You can go, I use ChatGPT, and I will tell ChatGPT the kind of diet that I want. And I say diet in loose terms. I don't mean like a fad diet, but I tell it to create a meal plan for me based on the macros that I want. So protein, carbs, fat. Um, and the goals I'm trying to do. And I did that, and I just recently had a nutrition consult with a nutritionist out of Birmingham through the Nourish app. Our Blue Cross Blue Shield actually paid for it, so it was free. So I did a consult last week, and the plan that I put together based on what I knew my numbers needed to be and what the registered dietitian actually did for me was very, very similar. So I think that's always a good way that you can build upon the resources that you have, and also you can kind of outsource your thinking on that, right? I could sit down and make a menu plan, but it was much faster and easier for me to consult with my nutritionist and then have ChatGPT make a menu for me with a grocery list. That's a really good way to make life easy, right? Make these things simple for you. So this is an image. It is cropped because I pulled it from the interwebs. I just wanted you to be able to see the relationship between your total cholesterol, which is your LDL plus your HDL plus your triglycerides divided by 5. So your total cholesterol is a picture of all of those numbers together. And what I want you to know about that is that when your total cholesterol is above the normal level, you need to be asking questions about, well, what is your LDL, HDL? What are your triglycerides? Because you can be over the level of your total cholesterol number, that target number, and it's because your HDL is high, which would not be concerning. That would actually be good. We don't want you to lower your HDL. We usually like to see it over 60 for that. So triglycerides is under 150. HDL, usually we like to see above 60. And then when you look at your other cholesterol numbers, we like to see that your then it can vary based on age and gender, but your total cholesterol we like to see under 200. And then LDL we like to see under 100, which is ideal. And then it's broken down by borderline or too high or too low. And so again, these are just numbers. It's just a range, but you're going to have a healthy level for you, and you're going to know when you feel your best. And that's why it's important to have good numbers over a number of years to see those patterns. Okay? I hope that helps. So the excess cholesterol, like I mentioned, gets deposited in those arteries, and then those arteries become less flexible. So think about that garden hose again. When it gets rust and buildup in it, it becomes brittle and it breaks or it cracks, and it doesn't work well. And so that's what happens to our vessels. So you get this hypercholesterolemia. It's a really long word. And then you get atherosclerosis, and you get heart disease, and then you get heart attack and stroke. And so you sometimes end up in an emergency room with a heart attack or stroke symptoms. But what preceded that was the heart disease, which was the hardening of the arteries with this atherosclerosis, which actually was having too much of the cholesterol. And so it's really important to know that you have to understand that you might not have any warning signs initially. So having your high blood pressure checked and having your cholesterol checked will be really good indicators of where you need to take action. So again, heart attack and stroke become because of the poor circulation, because of those cholesterol deposits. And the high blood pressure is really just the red flag. It wasn't really the root cause. It was the cholesterol usually. So this is another image looking at kind of a section of what an artery or vessel would be. So a normal artery is going to be completely open. You start to have what we call some occlusion here when you see that yellowing. That's the cholesterol. So that's the initial stage of cholesterol plaque or atherosclerosis. And then significant is here. So advanced cholesterol plaque. And then this is end stage. And what I want you to see about this last image is that this is considered a complete blockage at like 70 to 80%. Now, I'm an all or nothing kind of person. And so when I think about a complete blockage, I'm thinking 100%. But in medical world, when it comes to cardiovascular health, a complete blockage is actually 70 to 80%. So if you have more than that kind of occlusion, if you're at 100% blockage, that's going to be like an immediate medical emergency kind of thing. So you're having at 70, 80% reduced capacity, you're having significant symptoms, and you're probably aware of it at that point. So inflammation plays a role because think about this. We've had too much sugar, not enough water, so the blood is thick. We've got the adipose tissue compressing, making it, the vessel smaller. We have not given it enough rest, and we have not given it enough sleep, and so we're tired and sluggish. And then add on inflammation. And inflammation also makes things, really kind of compress and tighter because there's extra fluid on board. So then you add inflammation on there, and you've got even more of kind of this challenge. So you really have to think about, where am I having inflammation? Is it something that I can actually impact? Because you might have inflammation because you sprained your ankle. That same numbers on your blood work are going to go up as if you have systemic inflammation all over because you've got something going on like autoimmune disease or something like that. So knowing your inflammation markers are helpful to an extent, but you've got to kind of do a deeper dive and see, okay, well, where is this inflammation coming from? Doing something like an anti-inflammatory diet, eliminating known inflammatory foods, taking things like omega-3s if your healthcare provider says it's okay, having more of a Mediterranean diet, adding in walking. Those are all things that are good first steps to take. Do one thing at a time and then just keep adding on as you're able. That will help make the change in the lifestyle switch kind of more sustainable. There's warning signs of having these, what we call clogged arteries, which is just that cholesterol getting, more and more built up. And those are things like shortness of breath, fatigue, chest pain. You can have vision changes, lower back pain, which is always interesting. Not something you normally think about, but it's because of inflammation. So any kind of nerve pain, which is also related to the painful or numb or cold hands or feet, also erectile dysfunction for the same reasons, and then of course eventually stroke and heart attack. Okay, so blood pressure we've talked about a good bit, and we talked about how you're really increasing the blood flow, the pressure of the blood to get through those narrow passageways. And so I think we're good on that, but I just wanted you to see a couple of images that make it even more um, kind of obvious. So when you look at your systolic pressure and your diastolic pressure, your systolic pressure is the measure of that heart when the heart contracts. So your diastolic is measured between beats when the heart relaxes. And so a lot of times people will be really concerned about the systolic pressure. And of course, if it's increased or raised, we want to be, mindful of that. But the diastolic pressure, when you have your heart supposedly at rest, it's going to be that lower number typically for that reason. When that number elevates, that's a little bit more concerning usually, because then that means that your heart isn't getting to rest. So, like when you contract, that's going to be systolic. And then when you relax, you've got, that kind of relaxing of the muscle when that pressure should lower. If it stays high, then that means your body is going to be even more likely to fatigue. Okay. And so then it shows you here also another image of those blood pressures and the pressure that gets exerted on that vessel or on that wall. So hypertension, we used to say 120 over 80 was the ideal. Now we actually like to see it be less than 120 over 80. And so low 100s over, 60s to 70s. Usually 70s is going to be more preferred because if you're getting into like 100 over 60, especially for people who, have a really active lifestyle or who have had a higher blood pressure, you're probably going to be really tired, really fatigued if you get to that kind of low blood pressure. So probably 170, 120s, 110s over 70s is probably going to be more sustainable and doable for you. But again, everyone feels better at a different pressure. It's just important to know that 120 over 80 is now the max normal, and we like to see it a little bit lower because your pressure is going to raise and lower throughout the day. So if you're already at 120 over 80 and then you go out and get into traffic and get upset, or you have to like brake really hard to not hit the person in front of you in traffic, your blood pressure is going to spike. It's going to go up. That's your body compensating. That's normal. That's natural. But then you have less wiggle room because you are already at the max normal range. Does that help? I hope that does. So recommendations here is another infographic that kind of shows the different stages of hypertension. Again, 3 or more readings of a high blood pressure is going to get you a diagnosis of hypertension. So everyone on this call is going to have high blood pressure this week at some point, I would imagine. But not all of us have hypertension. So hopefully that helps you understand the difference between the two. So hypertension symptoms, again, we say it's the silent killer, that it doesn't have symptoms, but actually you can have headaches, shortness of breath, nosebleeds, flushing, so redness in your face, dizziness, chest pain, irregular heartbeat, pounding in your head, neck, chest, or ears, visual changes. You can even have blood in the urine, but that's usually late stage. And then fatigue or confusion or just brain fog, because you just don't feel well. So again, this is the requirements for an actual diagnosis. But just remember that blood pressure fluctuates throughout the day, and that's normal. Other health effects of blood pressure, of course, it can impact all of your organs, including your kidneys, your eyes, all the major organs. And then there's just some numbers here about how many people are actually managing or experiencing high blood pressure symptoms. And a lot of people don't actually know. They're undiagnosed. So, risk factors, the things that you want to think about, you can control your stress to a degree. So, stress, smoking, any tobacco products or substances, controlling your weight, you're managing diabetes or preventing diabetes, your salt or sodium intake, reducing your processed diet, reducing your caffeine consumption, and other lifestyle factors. We can't control our family genetics or our ethnicity or our age or, our sex when it comes to the hormones that we have to a degree. So the other things that are not in red are the things that we can really focus our time and attention and energy, right? The things that matter, the things that we can control. And of course, there's medication treatments. You would work with a provider for a medication if that's the route that needs to be taken. But just like I said with my story earlier, just because you take medication doesn't mean that you can't do these other lifestyle factors. Because it's only going to continue to progress. Someone mentioned earlier that they're on blood pressure medication and they still have high blood pressure. That's very, very common. And there's a lot of factors at play. You can be doing everything quote unquote right, and that still be the case for you because there's just a lot with genetics and things at play, other medications influencing it. There's tons of reasons why that could be. But you want to control what you can control, and that's the lifestyle aspect. And you might just lower your medicine or get off of it eventually. Most people would have given up after 3 or 4 years, but I was tenacious. I was like, no, I do not want to spend the rest of my life on a high blood pressure medication when I'm only 31, when I'm only 32. And I'm about to be 39 next month. So fast forward all these years later, and I'm so glad that 31, 32, 33, 34-year-old me didn't give up because my health outcomes for me, particularly because I have a lot of other health concerns going on that I can't control, I'm better off for having been off of that medication for these numbers of years, because there's so much other things that I can't control, right? So diabetes again goes into this because it can be metabolic syndrome when it comes to inflammation. Again, if you like this kind of information, I highly encourage you to read Good Energy. It's a book by Dr. Casey Means, and she has a website and a newsletter that you can check out. She's a great resource and has become very popular lately. Um, Again, metabolic syndrome is going to be high blood pressure, high blood sugar, high cholesterol, high triglycerides, and then excess fat around the waist. And that is because the more adipose tissue that you have compressing the organs, the more likely you are to have issues with those organs. If you carry your weight in your face or in your lower body, that is not as much of a risk factor. Unfortunately, I tend to carry my weight around my waist, and so that does put me at risk for metabolic syndrome. Also, things like insulin resistance or PCOS play a factor as well, polycystic ovarian syndrome. So, the holistic approach to health, it's everything that we already know to do. I'm not going to make this be complicated because it is very simple. It's just not always easy. So, control what you can control. And then here are 7 steps to a healthier heart. So, again, the easiest thing is to stop doing the things that are making things harder for you, right? But it's also the hardest thing. It's the simplest thing, but it's the hardest thing. Um, and some days, I'm going to be honest with you, some days the only thing I have going for me is that I've never smoked, right? Because I do like sugar and I do like fried chicken and I don't walk enough sometimes and I do have a lot of stress and a lot of kids that I'm responsible for. I'm a mom of 5 teens and preteens and I have a busy life. So, I mean, sometimes the only thing I've got going for me is that I don't check the have you smoked? Have you used tobacco? Literally everything else sometimes is not going in my favor. And so I have to be really intentional about that. And I bet y'all do too. So, monitoring your blood pressure, maintaining your weight, again, working toward reducing the inflammation and adding in the good things, right? Add in more good things to crowd out the not so good things. So, if you have a really hard time wanting to get a Coke after work, that's a weakness for me. I have to really work on adding in more water. Instead of trying to cut out the Cokes first, add in the water first, and then you'll naturally kind of crowd out the room you have and the desire you have for Cokes. After 1 to 2 weeks of changing what you're eating and drinking, you crave that sugar less. So give yourself kind of that window. Watch your cholesterol, watch your blood sugar. You can get a monitor pretty cheaply, even without a diagnosis, on Amazon. There are a couple that I really like. There's one called Keto Mojo, and then it does blood sugar as well. I really like it, and you can get it off of Amazon without a prescription. It's the one I personally use. Get active. So 4 to 5 days a week for 30 minutes or longer is going to be a great place to start. And that can just be a simple walk around the neighborhood. You don't have to break a sweat or get your heart rate up to start. Just start walking. That's really the best thing to do, especially for 10 to 20 minutes after a meal. That will help dramatically lower your blood sugar. And that is another just amazing way to start really making a big difference. Walk with your kids or your neighbor or your spouse or your partner or your dog after a meal. Start with 5 minutes, 10 minutes, 20 minutes, 30 minutes. That's a really great way to do that, especially outdoors. And y'all, I know it's cold, but if you don't have a reason that would prevent you from going outside in the cold, go outside in the cold because that's going to make your body and your immune system more resilient. Eat a heart healthy diet, and that's going to be the things that we mentioned earlier. Okay, so wellness basics. I'm not going to go into these. This is just your resources right now. And so I have an entire talk on wellness basics, your five to thrive, and that's managing your sleep, your hydration, your healthy plate, so your nutrition, your body, and making sure that you're moving intentionally, not just a workout, because that's only 1 hour of your day, about 4% of your day. You need to be moving throughout the day, plus a workout, and then meditation or mindfulness or breaks or things like that. Okay. So I have a whole talk on that and then slides that go through what you can do to help with that. Mindset really does matter with this. Like, this is all about progress, not perfection. I am a recovering perfectionist, so I get that if that's a problem for you. It's a challenge for me. But think about gratitude. One thing you learned today, one thing you accomplished, one thing that just brought you delight or joy. Jotting down your glad is a great way to kind of book in your day. With at the end of your day, you've done this glad technique for mindfulness, and maybe you started your day with water and hydration or meditation. That's a good way to start and end your day for healthy habits. There's some other practical tips for you. I also have given a one-page sheet to Miranda that she'll share that has kind of a next steps for heart health checklist as part of our new takeaways in this new format. And of course, if you are smoking or vaping or tobacco using, all of those things, no judgment whatsoever. That's really common. And, it's the same thing with my sugar addiction, right? It's all something that we've just been in the habit of doing. But if you can reduce or stop that, it will really help you. And after 10 years of reducing or stopping your smoking, your vaping, your tobacco use, you almost go back to your normal lung function and kind of your baseline. So after 10 years, it's not that you are going to stop and that you can't reverse that. Research has shown 10 years later, it's almost as if you never smoked. My husband smoked for 15 years, and that was very true for him as well. But research shows that. So no judgment, just something to think about. Exercise recommendations. BMI is not the end all be all, but it is important to know your BMI, right? There's a lot of reasons why BMI is not accurate for some people, the way that it was studied and how it's done, but it is a good metric to see, are you making progress? So I do keep a check on this, but I don't let it make me sad. I just know, okay, I need to work a little bit more in this area. A 10% weight loss can be really significant in terms of changing your blood work numbers. The DASH diet's always good for people who have hypertension, and really it's just focusing on what we said, limiting sweets and sugars, limiting alcohols, limiting sodium. This is how you read a nutrition label. We're kind of always looking at how many calories are in something, but this is the way to look at your trans fat consumption. And more information on how to read a food label. And then some things to try: turmeric, omega 3s, fiber, more plants, healthy fats, and then things to limit. We all know stress management is key, so how we can reduce our stress, and then just a few other resources. And then I'll end with this quote from Arthur Ashe: start where you are, use what you have, and do what you can. Because again, we're humans and we have a lot on our plates, literally and figuratively sometimes. And so you can only do so much, but just pick one thing to start. I always recommend water. It's always a little bit easier to add water than it is to try to, start working out 5 times a week. Water is going to be a little bit more helpful. All right, I know that we're coming to the end of our time. I will stay on for a few minutes to answer any questions, but